Midday Live, LeeAnn, Tweeden, Dr. Drew, 800-222-5222. So we're going to talk a little bit about child behavioral psychology with, hope I get the pronunciation correct, with Dr. Mona Delahooke. Dr. Delahooke, am I pronouncing that correctly?
That's pretty close, Dr. Drew. Delahooke, thanks so much for having me on.
Thank you so much. So April is Autism Awareness Month, and your new book is Beyond Behaviors, Using Brain Science and Compassion to Understand and Solve Children's Behavioral Challenges. And I think you're suggesting that perhaps there's a more enlightened way to approach autism. Is that one of the cases you're making here?
Absolutely, yes. And in one sentence, I think I devote a chapter of the book to a new way of looking at behaviors in autism. Because right now, when a child is diagnosed, oftentimes one of the first things we do is send them to a behavior therapy, and oftentimes the behavior therapy is looking at normalizing behaviors or emphasizing compliance, but there's a different way to look at it, and that way is to look at behaviors as coping mechanisms or adaptations. And this is related to the exciting work of Dr. Stephen Porges. I think you know him, Dr. Drew.
Oh, my God, I know him well. What does he do now? What's he up to? Tell
Come
me more.
on, right?
Yeah.
He's a friend and colleague, and the neuroscientist that I appreciate and respect more than anyone else. And his idea is that what we're doing right now is that we are conveying to children that their behaviors are bad even if they're involuntary. So he views these behaviors as coping mechanisms and adaptations to that circuitry when a child doesn't feel safe.
Right, like flapping or something,
yeah,
when they flap their hands, or
tapping, saying things, or even behaviors that might look like a misbehavior, but they're actually a coping mechanism.
Sure.
So when we look at it through the lens of the autonomic nervous system, oh my goodness, we have a whole new treatment approach paradigm coming online.
And is this something that's one central nervous system helping another, or are there actually sort of specific kinds of interventions?
Well, the general idea is bringing the body and the brain together. Right. So you know how that different system, the system of the body up, the concept of the body up and the top down. Well, in autism, we know that there are unique differences for children in wiring. One of those differences is that there are there tends to be sensory overreactivities. Children may hear things more intensely, or taste or smell things more intensely, or feel sound or movement in a different way. And when that happens, like you said, LeeAnn, there could be a behavior associated with that, which is allowing the child to cope with the environment.
No, can I? Oh,
yeah, go ahead. Yeah.
My best friend Dana, her son Michelangelo, is on the autism spectrum. He's pretty solidly autistic, or as a person with autism. And what I've always found with him, and he's gotten better as he's gotten older, just learning, it's like Temple Granny, he's sort of learning what is appropriate behavior with his parents, but his parents accept that that's who he is, and he does a lot of stimming. He does certain things that, he calms himself during certain things, and he likes to swing a lot, like swinging high. He likes the taste of wasabi, things that are very powerful in his mouth, the strong taste. But do you feel like maybe there's the reason why people have tried to change through the behavioral, ABA or whatever, it's because we want them to be quote unquote normal when it's okay if they stem or do whatever. You know what I'm saying? Is it because we're uncomfortable, the normal, quote unquote normal people are uncomfortable with the flapping or the moving around? Is it our problem, not theirs?
I think it is. This is the brilliance of hearing from autistic adults now. I'm sure you're familiar with the neurodiversity movement.
Yes.
Now, many of the patients that I had when they were toddlers are teenagers or young adults. And so to me, they are the real experts. And LeeAnn, I touch on that in the book and saying perhaps it's the professionals and the systems and our outdated notions that need to change, and not the children themselves.
Well, isn't that generally the sort of philosophy of meeting them where they are?
Right.
Well, Dr. Drew, that's
knowing your children.
Or is that only part of the story?
Well, no, that's a philosophy that's well held in general parenting literature, but somehow, with behaviorism being the most recognized treatment for autism and the one that insurance companies recognize the most, that respectful piece falls off the ledge in many of the treatments for autism in favor of compliance, training, and normalizing behaviors.
Well,
and that we need to shift.
Sent a shudder down my spine when you said the one that the insurances were pay for, because it's unbelievable how frequently it is the resources that determine the clinical approach, and it's given us the opiate epidemic, ladies and gentlemen. That's how we got there. The insurance resources decided they wouldn't pay for chronic pain management any longer. We just were afraid of prescribing opiates. It's cheaper. They don't have to go to the doctor, and they're just sort of put out to pasture on opiates. Yeah. Well done, insurance companies.
Yeah, and when the autistic adults are telling you, no, that it was hurting me to try to do what you were telling us to do when we were younger. Look, autism, what we know now, right, it can't be cured, but we can live with them, and they are living, and they're growing old, and they're becoming adults, and they're in our society. So it's like, if they're telling us, we got to listen to them.
Yes, LeeAnn, you are so right.
We're speaking of
and maybe not even use the word cure, because it's a brain wiring difference. And
whoops, sorry.
So they could be respected and understood. Go ahead.
I have to go. I'm against the clock. We're speaking to Dr. Mona Delahooke. We're going to come back, and I wonder if when we come back, you can talk a little bit about what we've learned in general applied neuroscience and in this treat of autistic, sort of generalize out to other children what we might be able to do to learn, to expand our approach to parenting. How about that?
Fantastic. Would love it.
Dr. Mona Delahooke, the author of Beyond Behavior, Using Brain Science and Compassion to Understand and Solve Children's Behavioral Challenges, 800-222-5222. If you have questions, that's LeeAnn Tweeden. I'm Dr. Drew. This is Midday Live on AM 790 KBC. It is Midday Live. LeeAnn Tweeden, Dr. Drew. Number is 800-222-5222. We're speaking to Dr. Mona Delahooke. You can follow her at Mona, MonaDelahooke, also MonaDelahooke.com. And I was asking the question about expanding out some of these neuroscientific insights into general parenting. What would you say?
Absolutely. So one of the distinctions we can make is we have this idea of, what is a challenging behavior? A lot of those challenging behaviors that we're the most concerned about, biting, kicking, screaming, all of those, we tend to view them from the lens of being an intentional behavior. But many behaviors are stress behaviors. And that's when the child's not in control. And what they need at that point is for us to stay calm, stay regulated, and use our what Dr. Porges calls our social engagement system, instead of going straight to discipline. And I think
it's going, again, meeting them where they are, going on their level, using our face and our body to reflect an appreciation of their primary affect state. Not to be overtaken by the child's affect, but to try to express it on your face and to listen and feel what the child is experiencing and stay fully present with them, sort of meet them where they are with your body and see if you can form some sort of regulatory connection with them. Is that about right?
Wow. Hey, that was beautiful. And in simpler language, we might just say we stay calm and connected, and we show them with our body language, our tone of voice, our facial expression, that we see their struggle, that we see that they're in a challenge, not that we're going to be angry or discipline them for having a stress response. So it's being a little human.
Oh, yeah. And there's a particular thing about our voice that is most effective for this. It's called vocal prosody.
It's called vocal prosody,
Yeah, which is say, we understand. We use a certain kind of lilt. Women are extremely good at this and do it automatically. And in fact, our ear tunes to it. That same system tunes our ear into that prosody and helps us regulate.
It's funny. I find sometimes I have a 3 and a 5-year-old, so they're always fighting. And my daughter's the 3-year-old, and sometimes when they're wrestling or they're playing around, she will bite him. It's not very often, but she'll do it, and he'll scream, and I kind of like, what are you doing? And then she kind of looks at me, and I'm like, okay, Kaya, I know you're probably just feeling a little overwhelmed. He's bigger than you, but you cannot bite him him. And I just try to explain to her why she can't bite him, because it hurts and you don't want somebody biting you. But I never discipline her, because, I mean, even though if whether I'd never thought about if it was intentional or not, or if it was just her reacting, but I know it's just her reacting to him because she just feels like maybe she's getting overwhelmed because he's bigger and stronger, but I just try to explain to her why
she doesn't have a repertoire. She doesn't have a repertoire to manage.
So there I am giving her the boundaries of you can't bite people. That hurts, and you don't want to be bit. He doesn't bite you either, it's not right.
Sure. That's so nice. But by not disciplining her for it, you're respecting the fact that children at 3.5, most children don't have full control over their emotional and behavioral systems, right?
I don't. If they did, I'd be worried.
If they did, we'd be kind of concerned, right?
Yeah.
So, and as I'm sure you know, that intentional control over our emotions and our behaviors continues into the early 20s.
Yeah.
So we have an expectation.
I think it continues through life. I'm always trying to check my emotions.
In our country today, most people are not regulated, so just here we are.
It's a challenge. You got to think about it. Yeah.
You got to think about it and give them the benefit of the doubt. Children do well if they can, and going back to the world of autism, children who have brain wiring differences and who experience the world in more intensely or in a different way than neurotypical people do need so much love, respect, compassion, instead of more rules and rewards and stickers and stuff like that.
Can I just make an observation of the parents that I know that had a problem when they found out that their child was diagnosed on the autistic scale, was a lot of times they have their own preconceived notions, and they were like, oh my God, my kid's not going to be the next Derek Jeter, my kid's not going to be the the brain surgeon or what have you. And but once they realized that their kid was going to live a good life and was going to be fine, it's just their kid was going to be different than what they thought. Once they accepted it, then everything changed and they were okay.
That's wonderful. Yeah.
Well, we're going to have to wrap it up. We appreciate you being here, Dr. Delahooke.
Thank you so
we
much.
Follow you at MonaDelahooke.com. Again, that's MonaDelahooke. And the book is Beyond Behaviors, Using Brain Science and Compassion to Understand and Solve Children's Behavioral Challenges. And if you see either the Porgeses, Sue Carter or Steve, please let me know. And please say hi for me, rather.
I'll be seeing him in a couple of weeks in Florida. I will let him know, Dr. Drew. Thank you both so much for having me on.
Absolutely.
Send him my best. Thank you so much. We'll see you soon.
Thank you. Bye now. Thank you.